Isabel, I still remember sitting in my first year medical school classroom listening to you and your sister talk to us about being patient advocates for children with cystic fibrosis. And then today you took to the stage again to talk about different ways of learning to say goodbye. What was your main message that you were hoping that the audience members would take away today?
I think my main message is that saying goodbye is a fact of life. Many people don't want to focus on that because it's emotionally laden and heavy, but we say goodbye to our loved ones. I mean, all of us say goodbye to our loved ones at some point in our lives. We say goodbye to our friends when we graduate. We say goodbye every day, but sometimes we don't actually stop and reflect on what it really means and how we can be more emotionally accepting of the natural cycle of life. And so saying goodbye through death is the hardest to deal with, but doctors and healthcare professionals and patients, we have to become more comfortable having this conversation that saying goodbye is hard, but it's also a good thing to do.
Right. And how do you use your life experiences to shape your current role as a bereavement social worker?
Well, being born with cystic fibrosis, I knew from a very young age that my life would be short. And I also said goodbye to dozens and dozens of friends. And so I have become, through practice, become more comfortable with talking about death and dying and acknowledging that it's a normal part of the cycle of life. I also have just become more empathetic towards the intense reaction of survivors. And many times I tell people I work in hospice and they say, oh God, that's so sad, it's about dying. But actually hospice is about living and it's about life. And bereavement care is about living again after you've lost a loved one. And grief is actually a biological response. I mean, we're, as I said before in my talk, we're wired for attachment, and being separated results in a physiological response. Doesn't feel good, it's hard, but that's how we survive as social species, by bonding with each other. And so I think I've, from my own experience, have really been able to normalize grief and to acknowledge that people are, that grief is a normal response.
And have you received pushback from people that you've worked with who perhaps don't want to confront the idea of grief and of the death of their loved ones?
Definitely in the medical setting. I think that even doctors think death and dying or grief is sad, it's hard. I think often doctors are trained that death is a failure, when in fact the whole point of being a doctor is to support and hold someone up through their illness journey and acknowledging that someday that journey will come to an end. The role of a doctor is not to save someone's life, but to extend someone's life. And so, for example, my sister was diagnosed with cancer, but she lived very well in the last 2 years of her life, and we knew for her entire lifespan that she would die young. And I think it helped me to know that the doctors did everything that they could, but what I needed more from the medical team was support in helping her accept that the end was okay.
And do you think physicians are the ones who should be better equipped to deal with these kinds of issues and talk about them with patients and their families?
It really depends on the individual as to the comfort level of the individual with their own dying. I definitely feel like having a personal death awareness class or at least a session for students is really important so that they can become more comfortable talking about dying. We've experienced some extraordinary doctors who have been able to not work with their minds but work with their hearts, because that's what it takes at this stage of life, is to really open up your heart and connect and acknowledge and empathize with the experience a patient is going through at the end of their life. rather than just focusing on the pain medications and the dosages and the blood pressure and all of those mechanics of dying that are important, but they don't fully reflect the family's experience.
Right. And in your talk, you mentioned many lessons that you had learned about saying goodbye. What do you think is one way for people to start learning those lessons and really live them out through their grief?
I think to learn the lessons of saying goodbye, first of all, sometimes we just need to stop. We need to stop the busyness, all of the extraneous and information and energy that's coming into our brains, and just reflect on what's coming out of our hearts, and to not be afraid of any difficult emotions that come up when we think about the loss of a loved one. I think that we need to help people be comfortable with their emotions. That's not only a doctor's role, but a social worker's role and a nurse's role. It's definitely a part of medicine that's kind of ignored. But the emotional response to illness and death is culturally and socially derived. And so as an institution, I would hope that we can encourage patients, families, and providers to be in touch with some of the difficult emotions as well as some of the positive emotions, and connect to families that way.
Is there anything else that you want to talk about that we haven't talked about yet so far?
I would just encourage doctors or pre-meds and pre-doctors to try to the best of their ability to carve out some time in their very full lives to reflect on why they're doing this job, and to acknowledge that they're going to be healing a lot of people, but they also will not heal some people, and that it's not a failure, it's nothing they did wrong, but even touching a family's life at the most difficult place of saying goodbye, physicians and their art, their heart, and their warmth and their communication, most of all, can profoundly influence a good goodbye.
That's a very important lesson for all of us to learn. Thank you so much for sitting with us today.
Thank you.
And sharing
Thank you
your
so
stories.
much. Appreciate it.